So, hi friends, welcome back on the Unacademy platform. In today's YouTube live session, we'll study about the tuberculosis of various joints, including the hip joint, the knee joint, and short bones and port spine. We have already discussed port spine or port's paraplegia. Okay, so shortly we'll discuss that again also, but our main focus will be on the TB of hip joint and the knee joint. Okay, it is an important topic, especially for your university and prof examinations, and more 10 or 15 types of question can be framed. ज़्यादा difficult topic नहीं है, छोटी छोटी चीज़ें हैं जो आपको याद रखनी है, and sometimes one or two questions frequently come from this topic, so it is important for your competitive examinations also. Okay, so currently I'm working as an orthopedic house surgeon in SMS Medical College Jaipur, and I've cracked the same NEET PG examination last year, that is in 2020 only. Here I'm dealing your subject orthopedics, and we'll study in-depth orthopedics so that you can do well in your NEET PG, INI, CET, FMG like competitive examinations also, but also in your prof or university examinations. And we will have special focus on concept based studies, the x-rays, the images, the clinical scenarios, keeping in mind the coming next type of examination, the newer NEET PG pattern, and your practical examinations. So let's start today's session, and before starting today's session I will just briefly guide you about our various subscription plans that are available for the NEET PG on Unacademy. And the first one is your plus subscription plan. The plus subscribers will get access to all our live as well as recorded classes, the entire QBank, and they can also compete in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log in into multiple devices with the same account, so that they can study on any device of their choice at any time. And also the students or the subscribers will be given printed notes, but only those subscribers who will be subscribing for 12 months or more. And you can use my code, that is Anshul B10, while subscribing to get extra 10% off. The second one and the best one is the iconic subscription, and it is best not only on the Unacademy but across any digital platform for NEET PG in India. And what makes this best is that apart from the things that I have told you earlier, in extra में you'll get prep ladder, यानी जो मैंने पहले आपको बताया the plus subscription, that all you will get. And on extra में you will get the prep ladder, and all of the prep ladder including all of its QBanks, the video lectures, the rapid revision courses, okay, the test, grand test, etc., everything you will get. And on Unacademy extra में you will get well structured live batch wise classes, and we have formulated our batches as well as we have structured a course so as to build your basic concepts about the topic and the subject first. And also we'll try to correlate different subjects, like tuberculosis है वो आप medicine में भी पढ़ते हो, वो आप pathology में भी पढ़ते हो, वो आप pharmacology में भी पढ़ते हो, and orthopedics में भी अपन पढ़ रहे हैं. तो जहाँ जहाँ पे भी जिन जिन subjects में भी tuberculosis आएगा, so we'll discuss them cumulatively, and we'll also revise that thing कि yes ये चीज आपने आपके उस subject में पढ़ी थी, so that you can revise very well, you can understand the concepts also very well. Okay, this is the beauty of the iconic subscription, and खत्म नहीं हुआ है अभी. Also you'll get a individual test analysis after every test that you'll give, so that you can analyze your preparation, you can analyze कि yes this subject or topic का ज़्यादा revision चाहिए, या what am I missing, what are the things that I should concentrate more. Okay, so all these are included in the iconic subscription, and you can subscribe for the iconic subscription using this code to get extra 10% off. And special classes are very special, and I always emphasize on the special classes because they gives you extra edge over your competitors. And what makes this special is that they are live interactive classes which will give you classroom like feel. You can interact with the educators by just raising your hand digitally, you can solve your doubts there and there only. You can participate in polls, you can watch it anywhere, anytime. What you have to do, you have to just open your Unacademy mobile application and log in using my code, and both of which are absolutely free. So the entire special class is absolutely free, and also you will also get the digitalized lecture notes of every special class that you attend. Okay. Now, Unacademy is announcing a special NEET PG Combat examination or a test scheduled on 10th of October at 11 a.m. and this is a good NEET PG Combat. इसमें you can win scholarships worth 1 crore and more and other exciting prizes. What you have to do, you have to just enroll using my code, that is Anshul B10, and you can enroll it on the Unacademy mobile application or our website, and you have to solve the 45 questions in 60 minutes, and the test will go live on 10th of October 11 a.m. So please do enroll for the NEET PG Combat. And we have also raised a whole new feature called as raising a hand feature, and it is introduced to make our live classes more interesting and more interactive, because nowadays due to COVID, classroom like feeling is very difficult. All of you are studying on the digital platforms only, so give you a classroom like feeling, we have launched this all new feature which is called as raise a hand. You can just digitally raise your hand and ask your doubts and interact with your educator. Okay. And our QBank will have 25,000 plus questions, and it is very good. सिर्फ question के नंबर ज़्यादा होने से it is not good. It is good because we cover everything in a QBanks. You don't need to solve, or don't need to hop around on any other QBanks. You can solve them anywhere, anytime. You can bookmark the important ones, and also it covers everything, the entire theory notes, the recall questions, the previous year's questions, the clinical based scenarios, the x-rays, images, the recent advances, the CT scans, MRIs, histopathological slides, everything, instruments, practical examination, everything is covered in this QBank. So it is a must to solve for every student who is preparing for the competitive examinations. And you can subscribe for this QBank, and you can use this code while subscribing to get extra 10% off. And also we are organizing a free INICET mock test every month. One free test is organized, grand test. So on 17th of the October this month, from 2 to 5 p.m. in the afternoon, there is a grand test for the INICET 2021, which is absolutely free. And INICET is on November 14. So जो भी INICET के लिए prepare कर रहा है, they should surely give the test. Don't think कि I'm wasting my time. No, you are utilizing your time at the correct place. Why? Because don't think कि मेरा time waste होगा. You'll give 3 hours for the exam and 3 hours for analyzing the paper, reading the explanation part, etc. So in just 6 hours you are covering, or you are revising the top 200, the most important 200 topics of your entire syllabus. Okay, so think it like way. And 200 topics 6 hours में if you are covering, you are doing really great job, and it is very important for the INICET aspirants. So please do give the test on 17th of the October. And now, keeping in mind different sets of students who are focusing on different examinations, like some are focusing on the FMG, some are focusing on NEET PG 2022, or some are focusing on the INICET of this year, that is 2021. So we are starting focused and dedicated batches to these following courses from the 6th of the October, so you can subscribe for these courses. And also we are starting from 6th of October a very important, that is clinical case discussion and instruments batch, because जो भी आपने थ्योरी में पढ़ा है sometimes it gets boring या आपको ढंग से समझ नहीं आता है. So if whenever you see that part what you have read in the theory clinically in any patient, और सी कि यस ये मैंने थ्योरी में पढ़ा है बट ये क्लिनिकली ऐसा दिखता है या ऐसा प्रेजेंट करता है, सो यू विल नॉट फॉरगेट दैट, यू विल बिल्ड योर कॉन्सेप्ट्स. जो भी प्रॉब्लम आ रही थी आपको कुछ समझने में, यू कैन ऑल understand them very well, and very importantly it will develop your interest towards your study, towards your subject, which is very important. So you can subscribe for any of these courses, and while subscribing you can use this code to get extra 10% off. Okay, so this is a subscription plans of the iconic as well as the plus subscription, and here you can see the cost per month decreases significantly if you increase the duration of your months. And also you don't want to hop around and you don't want to read different topics from the different sets of the notes, or एक ही subject के different topics different sets of the notes से, because it will make your revision very hard. It will be very hard for you to understand the things and build your concepts and remember the things. So a single source of information for the entire journey is very important. So it is advisable कि economically भी अच्छा है and academically भी अच्छा है that you subscribe for a plan with longer duration, and you can use this code while subscribing to get extra 10% off. Okay, so let's start today's lecture about tuberculosis. Okay, so tuberculosis का अगर अपन overview देखें तो after lungs and the lymph nodes the most common site is the bones and the joints. Okay, tuberculosis lungs एंड lymph nodes के बाद सबसे कॉमनली या सबसे पहले किसको अफेक्ट करता है, इट अफेक्ट्स योर किसको अफेक्ट करता है, इट अफेक्ट्स योर it affects your bones and the joints. Okay, it affects your bones and the joints. Okay, so around only 1 to 4% of your total tuberculosis is in the joints. Okay, and bones या joints में से भी the most common site is your spine, followed by your hip joint and the knee joint. So spine is the most common bone or the joint involved, and it is called as the pot spine. Okay, and next second number पे hip, then your knee, then your elbow. अब ट्यूबरकुलर ऑस्टियोमाइलाइटिस भी हो सकता है अगर वो जॉइंट को इन्वॉल्व नहीं करता है, सिर्फ बोन्स को इन्वॉल्व करता है, एंड लीड्स टू द इन्फेक्शन ऑफ द बोन्स. सो ट्यूबरकुलर ऑस्टियोमाइलाइटिस जो होता है वो दूसरे ऑस्टियोमाइलाइटिस से डिफरेंट होता है. किस वे में? दी ऑस्टियोमाइलाइटिस अक्यूट और क्रॉनिक ऑस्टियो रेड की वो मेटाफाइसिस को अफेक्ट करता है, बट ट्यूबरकुलोसिस वाला इट अफेक्ट्स दी एपीफाइसिस. सो अगर एपीफाइसिस को अफेक्ट करेगा तो ऑब्वियसली इट इज मच क्लोजर टू दी joint, so it will lead to the early involvement of the adjacent joint. So adjacent joint का early involvement होता है in case of tubercular infection of the bones or the tubercular osteomyelitis, whereas in pyogenic involvement late होता है because it affects the metaphysis. Okay, and always the bony tuberculosis is a secondary type. It is followed by a primary focus either in the lungs or the lymph nodes, and the spread from there can be hematogenous through the blood or through the direct spread, like कोई focus है just adjacent to the bone, so from there it can migrate directly and cause the infection in the bone. And as you all know, tuberculosis is a chronic granulomatous inflammation with formation of very important caseous necrosis, and this is also seen in tuberculosis of the bones and the joints, the chronic granulomatous inflammation with caseous necrosis. नाउ ट्यूबरकुलोसिस होने के बाद जो बोन जॉइंट या जो अपनी बॉडी होती है, दे कैन रिस्पॉन्ड टू इट बाय टू वेज. फर्स्ट कैन बी योर प्रोलिफरेटिव रिस्पॉन्स, सेकेंड इज योर एक्सुडेटिव रिस्पॉन्स. इन दोनों में से जो कॉमन है दैट इज योर proliferative response. Okay, proliferative response is very common, much common in tuberculosis. And proliferative response में क्या होगा, there will be increased cytokines and the inflammatory mediators which will lead to the formation of the chronic granulomatous inflammation with fibrosis when it will heal. Okay, so chronic granulomatous inflammation and healing by fibrosis is characteristic of the proliferative response, whereas in exudative response नाम से ही पता चल रहा है क्या होगा, exudation होगा. Exudation means exudates, that is pus. Okay, so there will be formation of extensive pus, yani there will be extensive caseous necrosis without much cellular reaction. As we have seen कि proliferative में cellular reaction ज़्यादा होती है, तो cellular reaction कम होगी, but the pus formation will be very extensive, and so it is more common in immunodeficient people or the diabetics, HIV, or elderly people. Okay, or the people suffering from leukemia or the other cancer conditions. So in patients में it is generally common which type of response, exudative response. Okay, तो जब ये bone को affect कर देता है तो there is demineralization of the bone, because due to cellular reaction there is intense hyperemia localized at the bone, leading to the demineralization. First of all, cortex will be affected and the granulation tissue will be formed, and it will lead to the erosion of the joint space, the periarticular surfaces, the osteopenia होगा, lytic lesions होंगे, which will lead to the complete destruction of the joint or subluxation or dislocation of the joint. And जब ये सारा cold granulation tissue and all form हो जाता है, then obviously it forms, it bursts through the periosteum, it goes into the soft tissue where the caseous necrotic part will collect and it will form a cold abscess. Okay, and these cold abscesses can burst out through the skin as well, and they will form the chronic discharging sinuses. ओके, सो कोल्ड एब्सेस टीबी में होता ही है, क्रॉनिक डिस्चार्जिंग साइनसेस होंगे, एंड डीमिनरलाइजेशन ऑफ द बोन होगा, एंड ऑब्वियसली द बोन विल बिकम वेरी वीक, कैन लीड टू द पैथोलॉजिकल फ्रैक्चर, एंड इफ देयर इज ट्यूबरकुलर ऑस्टियोमाइलाइटिस इन द बोन, इट can easily go or spread to the adjacent joint. So ये ध्यान रखना, जो भी अपन अभी पैथोफिजियोलॉजी डिस्कस कर रहे हैं या फिर इवन वी आर डिस्कसिंग दी एक्सरेज या फिर कॉर्टेक्स को इफेक्ट कर रहा है, या जो भी अपन अभी डिस्कस कर रहे हैं, इट इज कॉमन इन ऑल टाइप्स ऑफ ट्यूबरकुलोसिस ऑफ हिप, स्पाइन, नी, सब जगह ये कॉमन होता है. जो भी डिफरेंसेस होंगे we'll discuss them in the respective sessions, but the common things in all we are discussing here, so I'll not be repeating them in that टॉपिक्स. ओके, सो अगर लॉन्ग बोन के अंदर टीबी ऑस्टियोमाइलाइटिस है, देन द मोस्ट कॉमन बोन इन्फेक्टेड और अफेक्टेड इज टिबिया. सो ये ध्यान रखना, अगर आपसे पूछे ट्यूबरकुलोसिस इज कॉमन वेयर, इट इज कॉमनेस्ट इन द स्पाइन, एंड इफ इट इज आस्क्ड की ट्यूबरकुलोटिक और टीबी ऑस्टियोमाइलाइटिस in which long bone, then you have to go for the tibia. In short bones, calcaneum and phalanges are involved. Most common short bone जो involved होती है, it is the calcaneum. And the phalanges also, TB phalanges होता है, and उसका एक special name है which is called as the dactylitis ventosa, or also called as the spine ventosa. ओके, तो ये ध्यान रखना, स्पाइन लिखा हुआ है या स्पाइना लिखा हुआ है तो कंफ्यूज मत हो जाना कि इट इज रिलेटेड टू स्पाइन. नो, इट इज नॉट related to spine, it is related to your phalanges called as the spina ventosa. Okay, remember this thing, it is important. And in the spine we all know it is called as the Pott's disease. Okay, so see what is this. This is your dactylitis ventosa, where you can see swelling and increased swelling in the acute stage. Okay, and when you see the skygram or the x-ray, there is destruction of the joint, complete destruction of the joint, with even pathological fracture and the erosion of the entire cortexes and the articular surfaces. So this is called as the dactylitis ventosa, tuberculosis of the phalanges. ओके, अब ये बात ध्यान रखने वाली है कि जो जॉइंट के अंदर जो इन्वॉल्वमेंट होता है ट्यूबरकुलोसिस का, इट स्टार्ट्स फ्रॉम वेयर, इट स्टार्ट्स फ्रॉम योर साइनोवियम, जस्ट लाइक रूमेटॉइड आर्थराइटिस. ऑस्टियोआर्थराइटिस में तो कार्टिलेज इन्वॉल्व होता था, रूमेटॉइड आर्थराइटिस में साइनोवियल मेम्ब्रेन इन्वॉल्व होती थी. सिमिलरली ट्यूबरकुलोसिस ऑफ द जॉइंट में भी फर्स्ट स्ट्रक्चर दैट इज इन्वॉल्व्ड इज कॉल्ड एज द साइनोवाइटिस. अब फर्क ये आता है कि ये जो होता है ट्यूबरकुलोसिस ऑफ द जॉइंट, इट इज ऑलवेज स्लो ऑनसेट, स्लो ग्रेजुअल ऑनसेट होता है हमेशा ट्यूबरकुलोसिस ऑफ द जॉइंट्स का, which will lead to the low grade synovitis. Okay, so the destruction is slow, and obviously whenever synovium is involved, there is hypertrophy and inflammation of the synovium, and it will lead to the formation of pannus. We have discussed that this in the rheumatoid arthritis, sorry. And this pannus will further lead to the erosion and destruction of the cartilages and the entire joint space, leading to the decrease in the space of the joints. Okay, and then joint can be distended with the pus, and it can get subluxated, and it will burst out in these soft tissues, where it will form the cold abscesses, and there the cold abscess can also burst out to the outer environment by uh, breaking in the skin or the soft tissue, which will lead to the formation of the chronic discharging sinuses. Okay, now healing इसमें किसकी कैसे होता है, just like in the lungs, the healing occurs by the fibrosis. अब joint है तो initially obviously there will be fibrous ankylosis. That means the joint जो होता है, जॉइंट की जो दोनों आर्टिकुलर सर्फेसेस होती है डिफरेंट बोन्स की, दे विल फ्यूज विथ ईच अदर. फर्स्ट दैट फ्यूजन विल बी फाइब्रस, जॉइंट मूवमेंट बहुत कम हो जाएगा, एंड जॉइंट मूवमेंट बिल्कुल ही खत्म हो जाएगा व्हेन दिस फाइब्रस टिश्यू इज कैल्सिफाइड, लीडिंग टू द बोनी एनकाइलोजिंग, लीडिंग टू द बोनी एनकाइलोजिंग. अब ये तो हो गया कि फाइब्रस एनकाइलोसिस क्या होता है एंड बोनी एनकाइलोसिस क्या होता है. So in ankylosing spondylitis also start fibrous के फॉर्म में होता है, लेकिन एंड में it goes to form the bony ankylosis. Similarly टीबी के अंदर क्या होता है, remember one thing, if tuberculosis is of the spine, then there will be bony ankylosis more common, and in other TB including the hip and the knee joint, then fibrous ankylosis will be more common. Okay, so fibrous ankylosis is common in heel tuberculosis of the joints, except the spine, where the bony ankylosis will be common. Okay, remember ये important चीज है, बहुत ये ध्यान रखना है. बोनी एनकाइलोसिस इन द टीबी ऑफ द स्पाइन, इन रेस्ट जॉइंट्स या बोन का टीबी में फाइब्रस एनकाइलोसिस इज मोर कॉमन. ओके, नाउ डायग्नोसिस में फर्स्ट ऑफ ऑल यू हैव टू टेक अ प्रॉपर हिस्ट्री कि किसी साथ में रहने वाले इन द सेम हाउस और क्लोज कांटेक्ट के ट्यूबरकुलोसिस तो नहीं है, बिकॉज ऑनसेट इज वेरी स्लो, एंड there are very less symptoms in the start of the disease, so extensive and detailed history is very very important. Okay, particularly in the countries where tuberculosis is prevalent, like in India mein tuberculosis is very common, so you have to get a detailed history. Secondly, there will be history of trauma. Patient आपको बोलेगा कि yes I had a history of trauma and उसके बाद से swelling आने लग गई है and there is loss of movement and all and etc. So don't just misjudge and fall for the trap that yes ये trauma की वजह से. No, take a detailed history. I'm again telling you, take a detailed history, and there you will find that there will be a period of no symptoms between the incidence of the trauma and the beginning of the symptoms of the bone. Okay, उसके बीच में एक time period आपको मिलेगा where there will be no symptoms related to the joint or the bone involved, and अगर ऐसा आपको history मिल रही है then you should suspect what, a tuberculosis of the joint. ओके, नाउ लैक ऑफ कॉन्स्टिट्यूशनल सिम्टम्स जो ऑलरेडी डिस्कस की, स्लो ऑनसेट होता है, तो जो इवनिंग राइज ऑफ टेम्परेचर, एनोरेक्सिया, वेट लॉस, फीवर, ये सब जो सिम्टम्स होते हैं दे आर कंपैरेटिवली लेस फ्रीक्वेंट इन ट्यूबरकुलोसिस ऑफ द जॉइंट्स एंड इट इज सीन इन ओनली अराउंड 20% ऑफ द cases. Okay, so remember this thing also, it is important. Now investigations में स्लो ऑनसेट है तो इसलिए बहुत मेटिकुलसली यू नीड टू सी दी एक्सरेज एंड दिस डायग्राम्स. तो उसको देखने का सबसे अच्छा तरीका है ऑलवेज कंपेयर इट विद दी ऑपोजिट साइड का नॉर्मल एक्सरे, सेम पर्सन के ऑपोजिट साइड का नॉर्मल एक्सरे. सो कंपेयर विथ normal x-ray of the same patient of the opposite side is very very important in the diagnosis of the tuberculosis. Now if there is will be tubercular osteomyelitis, वही सारी चीजें होंगी जो ऑस्टियोमाइलाइटिस में होती है, बस डिफरेंस विल बी फर्स्ट एपिफाइसिस इन्वॉल्व होगा, डायफाइसिस नहीं होगा. एंड सेकेंड डिफरेंस विल बी वेरी इंपॉर्टेंट, will be very less or minimal or even absent new bone formation or the periosteal reaction. We have read कि ऑस्टियोमाइलाइटिस जो होता है पायोजेनिक ऑस्टियोमाइलाइटिस, उसमें बहुत ज़्यादा इंटेंस पेरियोस्टियल रिएक्शन होता है. ओके, न्यू बोन फॉर्मेशन होता है विच इज कॉल्ड एज द involucrum. Okay, but this new bone formation or the periosteal reaction is minimal or even absent in case of tuberculotic or TB osteomyelitis. Okay, remember this thing. Now TB arthritis यानी joint में involve हो गया, so obviously there will be reduction in the joint space, erosion of the articular surfaces, and which will lead to the complete destruction, subluxation, dislocation of the joint. Okay, now osteoarthritis, yes, pyogenic septic arthritis में भी यही सारी चीजें होती है, but the difference is that एक तो उसमें सिम्टम्स जो होंगे वो स्टार्टिंग से ही सीवियर होंगे, जबकि टीबी आर्थराइटिस में इट इज स्लो ऑनसेट एंड सिम्टम्स बहुत लेट आते हैं. एंड ऑल्सो देयर इज subchondral sclerosis in case of osteoarthritis or the septic arthritis, but there is no subchondral sclerosis in case of TB arthritis. and हमेशा जब भी suspected हो TB किसी भी joint या bone में, या फिर diagnose कर लिया हो तो sorry, then also you should get a chest x-ray done every time so that you can see if primary focus is in lungs, and if lungs में है तो is it still active. Okay, now other investigations में blood examinations में TLC will be raised with lymphocytosis. Okay, Montague's test will be positive in children. ELISA can be used, synovial fluid aspiration or the aspiration of the cold abscess, and the pus for the acid fast bacillus strain AFB, or FNAC या biopsy या curettage के through you can also take the specimen and send it for the histopathological examination. ट्रीटमेंट के दो प्रिंसिपल होते हैं. एक तो होता है कि डिजीज को क्योर करना. डिजीज को क्योर करने के लिए द ट्रीटमेंट इज योर मेडिसिनल ट्रीटमेंट विच इन्वॉल्व्स द एटीटी, एंटी ट्यूबरकुलर ड्रग रेजिम. ओके, एटीटी विच यू ऑल नो, और अगर नहीं पता तो जस्ट ओपन योर नोट्स ऑफ द मेडिसिन एंड रीड इट. इट विल टेक अराउंड ओनली 5 to 10 minutes. ओके, एंड सेकेंड पार्ट इज दैट जो जॉइंट या जो बोन अफेक्ट हो चुकी है और वहाँ पे जो देयर इज डिस्ट्रक्शन, so first of all you need to take care of the joint and the bones, then you have to reconstruct it if it is necessary. Okay, so control of the infection is the must by the anti-tubercular drugs, and anti-tubercular drugs में there are HRZES. Five drugs are most important. H for isoniazid, R for rifampicin, Z for pyrazinamide, E for ethambutol, and S for streptomycin. Streptomycin is given only parenterally, while all these are given orally. Okay, and बाकी all these are given orally. Now rest is very important, because आपने rest नहीं करा उस part को, there can be pathological fracture or dislocation, subluxation. So upper limb में plaster slab, lower limb में traction के through, and if there is spine का involvement, you have to do for the bed, go for the bed rest. And ये ATT start करने के बाद when the infection will subside, then you have to go for the proper physiotherapy. And very important is building up the patient's resistance, because in our population, in case of Indian scenario, more than 70 to 80% of the population have a tuberculosis bacteria within their bodies. But it's just that whenever there is decrease in resistance of the patient or the body, the focus will become active, the tuberculotic focus will become active, and the bacteria activate okay, it will cause the tuberculosis. So resistance build up karna is very important, and it is built up by giving antioxidants, vitamins, minerals, and high protein diet, fresh air and sunlight. These all help to build up the general resistance, and it is very important. Okay, now while how can we do the care of the affected part? Proper positioning, so that contractures नहीं बने जब आपके fibrosis हो. और mobilization should be timely and in a very structured manner and in a supervised manner. Okay, jaldi bhi nahi karana, late bhi nahi karana. So you should be in contact with a physiotherapist or a good doctor. Okay, and if it is if there is destruction and ankylosis has set in, then ankylosis generally occur when in a position of the joint which is most useful functionally. Exercises we have already discussed ki yes, exercises are very important. Exercises are very important. Okay, and a structured way mein and supervised way mein you have to do the weight bearing also. Okay, now we'll come to the different types of drugs. तो दो टाइप की ड्रग्स होती है. The first one is your bactericidal drugs. Okay, so जो first drugs होती है, they are your bactericidal drugs, that is they kill the bacteria. Okay, and इसमें होता है आपके H, R, Z and S. Okay, These are first the rifampicin. It is hepatotoxic, pink colored, and maximum is 10 mg per kg, that is 60 mg. Isoniazid, it is also hepatotoxic and it causes peripheral neuritis. Maximum is 5 to 10 mg per kg. Maximum dose is your 5 to 10 mg per kg. And third is streptomycin, which is given parenterally and it leads to the vestibular damage in the ear. Vestibular damage, plus it is also nephrotoxic, and also important side effect is your circumoral paresthesia is also there, and the maximum dose is 30 mg per kg. And Z means pyrazinamide, it is also hepatotoxic. Okay, and the maximum dose is 25 mg per kg. Okay, remember this thing. Now bacteriostatic drugs are ethambutol, and it leads to optic neuritis and the color blindness. Okay, it leads to optic neuritis and the color blindness. Maximum dose is 25 mg per kg for the 4 weeks. Okay, in the intense phase. Then in the continuous phase it is 15 mg per kg. Cycloserine, ethionamide, PAS, that is para-aminosalicylate, these all are used in case of resistant tuberculosis. Okay, and the cycloserine C से C CNS toxicity होगा, tremor, headache. Ethionamide में anorexia, nausea, vomiting होगा, and PAS also have the anorexia, nausea and vomiting. No need to learn their doses. Okay, now operative intervention में what you can see, if the diagnosis is doubtful, you can go for the biopsy. If there is cold abscess, so generally cold abscess जो होता है stationary and small, it can be it heals by fibrosis and it will regress. But if there is a bigger cold abscess, then you can drain it, you can do the aspiration and the evacuation, or curettage is important if the lesion is near to the joint, because timely if you don't remove the necrotic part or the infected part, then it will involve the adjacent joint space also, which will be very difficult to treat. Okay, so remember this thing, it is important. Now joint debridement also you have to do, just like the curettage of the lesion. Joint, अगर joint involve हो गया है and you have diagnosed it early, then you have to do the debridement of the joint so that healing takes place early and there is no destruction or ankylosis of the joint. You can do the synovectomy by removing the hypertrophied pannus. ओके, और सैल्वेज ऑपरेशंस ये किस में करते हैं, जब अगर जॉइंट कंप्लीटली डिस्ट्रक्ट हो चुका है, सो यू कैन डू सम सैल्वेज ऑपरेशन और डीकम्प्रेशन इन केस ऑफ spine में अगर there is lesion of tuberculosis, then it can lead to the compression of the nerve root, जिससे POTS पैराप्लेजिया हो सकता है. सो डीकम्प्रेशन करना पड़ता है. सो व्हाट इज सैल्वेज ऑपरेशन? सैल्वेज ऑपरेशन का एक एग्जांपल है हिप टीबी के अंदर, called as the girdle stone arthroplasty. Okay, this is an x-ray of girdle stone arthroplasty. उसमें क्या होता है, this diseased जॉइंट जो होता है इसको आप कंप्लीटली द हेड ऑफ द फीमर को रिमूव कर देते हो. सो इससे ऑब्वियसली देयर विल बी लिम्पिंग, पेशेंट नॉर्मली चल नहीं पाएगा कंफर्टेबली, बट द पेन विल नॉट बी देयर. ओके, सो द मेन प्रॉब्लम इज पेन. सो पेन से को रिलीव करने के लिए, स्पेशली इन द एल्डर एज ग्रुप्स, व्हाट यू डू द girdle stone टू रिलीव द पेन. Okay, now we'll start the tuberculosis of the hip. So spine के बाद second most bone or joint involved in the tuberculosis is your hip. Okay, the second most involved is your tuberculosis of the hip, and it is common in the children and the adolescent age group. Okay, it is common in children and adolescent age groups. Okay, so pathology दो टाइप का होता है tuberculosis, ये ध्यान रखना. फर्स्ट इज योर osseous एंड सेकेंड इज योर synovial. osseous नाम से पता चल रहा है कि स्टार्टिंग या जो अर्ली स्टेज होगी, स्टार्टिंग या अर्ली स्टेज के अंदर ही what the bones will be infected or bones will be affected in the initial lesion. It is called as osseous tuberculosis, which is seen in the hip joint. But in the knee joint के अंदर you will have the synovial tuberculosis, where the lesion will begin in the synovium, where the infection will begin in the synovium, then it will affect the cartilages and the bones. Okay, the synovial seen in the knee joint and the osseous tuberculosis seen in the hip joint. Okay, now as in the lungs, in the bones also there is small multiple cavities. Okay, in the hip के case में it will be in the femur head and the acetabulum. There will be destruction of the acetabulum or the head and they will get resolved. So इसमें क्या होता है, एक special feature होता है acetabulum का, which is called as wandering acetabulum. So कहीं पे भी if you hear about the term wandering acetabulum, then it is TB of the hip joint. क्या होता है, there is dislocation of the femur head. Okay, and the dislocation of the femur head की वजह से the acetabulum is empty, which is called as the wandering acetabulum. And later on pus होके cold abscess हो सकता है, pelvic abscess हो सकता है, and discharging sinuses भी हो सकते हैं. See, this is a case of TB of hip joint, where you will have a wandering acetabulum, and it is corrected by total hip replacement, that is THR, but it is done only after starting the ATT and controlling the infection. Then you go for the definitive treatment of the bones. Okay, so clinical features is disease is also always insidious or slow onset. Okay, so chronic course होता है, apathic and pale हो सकता है, anorexia हो सकता है, and the first symptom or the initial symptom of the TB of the hip will not be pain. Okay, it will be the stiffness. Remember this, stiffness is the first or the initial symptom, pain is not the first or the initial symptom. The child may complain of night cries or the starting pain, because when the disease is advanced, so there will be rubbing of the infected or the erosed articular surfaces. Okay, because especially it occurs in the sleep. अब आप पूछोगे स्लीप में क्यों होता है सर, तब तो मूवमेंट भी नहीं होती. स्लीप में इसलिए होता है बिकॉज द मसल्स आर ऑल्सो रिलैक्स्ड. तो जरा सा मूवमेंट भी due to the less tone of the muscles, the articular surfaces will do friction against each other, which will lead to the night cries, or also called as the starting pain. And later obviously, like in any other joint, the cold abscesses or the discharging sinuses can be formed. Okay, gait. टीबी का गेट बहुत बहुत इंपॉर्टेंट है. द फर्स्ट साइन इज lamenessness. Okay, what is lamenessness? मतलब not a active walk, धीरे 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 करके, and with a pelvic tilt the patient walks, but the typical gait is called as the antalgic gait. Okay, we'll come to that. अब ऐसा क्यों होता है, बिकॉज हिप के अंदर, हिप टीबी ऑफ द हिप के अंदर व्हाट इज देयर, टीबी ऑफ द हिप के अंदर देयर इज, let me adjust my screen. Okay, okay, now it is good. I've seen it. नाउ टीबी ऑफ द हिप के अंदर क्या होता है, इन टीबी ऑफ द हिप देयर इज फ्लेक्शन डिफॉर्मिटी, ओके, एंड वी हैव रेड कि फ्लेक्शन डिफॉर्मिटी ऑफ द हिप को टेस्ट करने के लिए एक टेस्ट भी होता है। कौन सा टेस्ट होता है? It is called as the Thomas test to test the flexion deformity of the hip. Okay, so due to the flexion deformity of the hip, the there is loss of movement. So जो pelvis का जो movement होता है, it is lost. So to compensate it, there is forward and backward movement of the lumbar spine. Okay, and there, due to this, first of all, there is exaggerated lumbar lordosis, and there is more responsibility on the lumbar spine for the propulsion or the movement of the lower limb. So इस type के gait को क्या बोला जाता है? Stiff hip gait बोलते हैं। And in the later stages ये stiff hip gait is exaggerated because of pain। ओके क्योंकि स्टार्टिंग में पेन इतना नहीं होता, बट इन द लेटर स्टेजेस जब इरोजन एंड डिस्ट्रक्शन ज्यादा हो जाता है देयर इज पेन। सो दिस स्टिफ हिप गेट इज कॉल्ड एज when it becomes painful, very important, painful gait or the entalgic gait, very important is that it is called as the entalgic gait. And what it looks like, it looks like this, okay, it is typical entalgic gait because of increased lumbar lordosis and flexion deformity. So there is stiffness, no movement of the hip joint. So this type of gait is called as the entalgic gait, which is a typical feature of tuberculosis of the hip. Other features जो होंगे वो क्या क्या होंगे? First there will be wasting of the muscles, the thigh and the gluteal muscles, swelling, cold abscesses, discharging sinuses, and deformities. Remember, initially the gross deformities are not there, but when you will inspect meticulously, you will see ग्रॉस डिफॉर्मिटी एंड हिप जॉइंट पे जो डिफॉर्मिटी होती है। वैसे तो वील स्टडी की डिफरेंट स्टेजेस में डिफरेंट डिफॉर्मिटीज होती है, बट आपसे अगर कोई पूछे व्हाट इज द डिफॉर्मिटी और द एटीट्यूड ऑफ द लोअर लिम्ब इन केस ऑफ द TB of hip joint, then the answer will be the lower limb is, or the hip joint is in flexion, adduction and internal rotation. Okay, flexion, adduction and internal rotation. Okay, now shortening, there is generally shortening, अब दो टाइप की shortening होती है। First is true shortening और the and second is the apparent shortening। तो इन दोनों को पढ़ने से पहले you should know कि what is true length and what is the apparent length of the lower limb. Okay, so I have an image for this. Yes, here is the image. Here you can see that this is your normal individual. So जो this is your ASIS. Okay, this is your ASIS, this is your ASIS। तो जिफॉइड प्रोसेस से लेके मीडियल मेलियोलाई तक जो लाइन होती है, इसकी जो लेंथ होती है, इट इज योर, okay, it is this length, it is your true length, and ASIS से medial malleoli तक की जो length होती है, it is your apparent length। okay, it is your apparent length। so if there is true shortening, if there is true shortening, so क्या होगा, जो ASIS से medial malleoli, इन दोनों को अगर आप compare करोगे, so this length will decrease, so this is called as the true shortening। but in case of the apparent shortening, what you will see, you will see that there will be pelvic asymmetry। सबसे पहले there will be pelvic asymmetry, and जो नॉर्मल लेंथ है उस उस पेल्विक एसिमेट्री की वजह से क्या होगी, देयर विल बी एक साइड की लेंथनिंग एंड एक साइड की शॉर्टनिंग। ओके, सो दिस इज कॉल्ड एज द एपरेंट लेंथ डिस्क्रिपेंसी। ओके, सो वील स्टडी की यस क्या होता है। सो जनरली अगर आपसे पूछे कि हिप जॉइंट में होगा क्या, सो देयर विल बी true shortening। okay, in hip joint what you will see, in hip joint you will see there will be true shortening of the hip joint, true shortening of the hip joint except in the stage 1. या तो इतना से याद रख लो, नी में भी ऐसा ही होता है कि इनिशियल स्टेज और द स्टेज 1 में देयर इज इंक्रीज इन द जॉइंट स्पेस, इंक्रीज इन द जॉइंट स्पेस भी होता है, लेकिन उसकी वजह से अपेरेंट लेंथनिंग नहीं होती है. बट टू रिमेंबर कि joint space increase होगा and in the initial stage there will be increase in the length, यानी apparent lengthening हो जाएगी. But in full fledged tuberculosis of the joint or a typical tuberculosis of the joint, there will be shortening, that to true shortening. Okay, so अब क्या होता है, what is true length? True length, it is the actual shortening of the bones because joint is destructed, so obviously joint space कम हो गई, so there will be true length. So true shortening भी होती है, and also due to abduction and adduction deformity there is pelvic tilt like we have seen in the picture. So due to this pelvic tilt there is discrepancy in the apparent length also. So pelvic tilt की वजह से if there is change in the length, that is called as the apparent tilt, lengthening or the shortening. and अगर joint space या joint proper के destruction की वजह से हो रहा है, then it is true shortening. Okay, remember there is stiffness, there is ankylosis, so both active as well as passive movements are limited in all the directions. And if you attempt to move the joint, what will be there? There will be muscle spasm. Okay, and this is called as the ankylosis of the hip, and later it will lead to the bony ankylosis. But as you have discussed, bony ankylosis is a characteristic feature of TB of spine. In rest other joints, most common will be of fibrous ankylosis. There can be dislocation, and the dislocated hip can be felt in the gluteal region. And if there is dislocation, you can diagnose it by the telescopy test, which we have discussed several times. Okay, now we come to the stages. So stage 1 जो होती है, it is obviously stage 1 early stage में we have seen कि it is synovitis. Okay, it is synovitis. So firstly, synovial membrane is affected in TB of the joints, unlike the pyogenic arthritis. But remember, hip joint is called as the osseous tuberculosis and knee joint is the synovial tuberculosis. So synovitis, so there will be effusion and of the joint. So the यहाँ पे stage 1 में या initial stage में क्या होगा, joint effusion होगा, and the attitude will be flexion with abduction and external rotation. Okay, not internal rotation and adduction. Stage 1 में there will be flexion, abduction and external rotation, and this abduction flexion deformity is compensated by the tilt in the pelvis. Okay, we have seen this in the Trendelenburg gait or the Trendelenburg sign जो अपन पढ़ते थे. Okay, Trendelenburg gait or the Trendelenburg sign. See, if pelvis, this is the affected side, मान लो this is the affected side, so what will happen? The pelvis will tilt down in the opposite side and the trunk or the body will tilt at the affected side. Okay, so उसको इस abduction and इसको compensate करने के लिए there is pelvic tilt. So remember, stage 1 में the limb is in external rotation, abduction and flexion. Okay, so if there is no abduction or adduction, then the apparent and the true length will be the same. But if there is adduction, अगर आपके adduction हो गया, so the true length will be more than the apparent length, so there will be what? There will be shortening, and it is called as the apparent shortening. And in case of abduction, the apparent length will be more than the true length, so there will be apparent lengthening. तो ये याद रखना है कि कोई आपसे पूछे टीबी हिप में क्या होता है, ट्रू शॉर्टनिंग होती है। लेकिन इनिशियल स्टेज या स्टेज 1 में टीबी हिप में क्या होता है, देयर इज अबडक्शन, वी हैव सीन, क्योंकि ट्रू शॉर्टनिंग होती है तो देयर इज फ्लेक्शन, adduction and internal rotation, but in the initial stage there is flexion, abduction and external rotation. So उससे क्या होगा, उससे आपके क्या होगा, abduction है, so abduction में we have seen कि the apparent length will be more, so there will be apparent lengthening in the initial stages or the stage 1 of the tuberculosis. ओके समझ आया, वेरी इंपॉर्टेंट, वेरी कंसेप्चुअल, वेरी इजी टू रिमेम्बर. ओके, this we have already discussed. Now stage 2 is the stage of arthritis, जहाँ पे the joint will be involved and the arthritic changes आने लगेंगे. Okay, and in this stage the articular cartilage is involved and this will lead to spasm of the muscles. And अब यहाँ पे क्या होगा, flexion, adduction and internal rotation होगा and there will be pelvic tilt also. ओके, अब स्टेज 2 में ऑब्वियसली देयर इज अडक्शन, सो अडक्शन है तो वी हैव सीन हियर कि अडक्शन में क्या होगा, द ट्रू लेंथ विल बी मोर एज कंपेयर टू द apparent लेंथ, सो देयर विल बी व्हाट, देयर विल बी apparent शॉर्टनिंग. ओके, यहाँ पे क्या होगी, यहाँ पे स्टेज 2 में या आर्थराइटिक चेंजेस में देयर विल बी व्हाट, apparent shortening. Okay, there will be apparent shortening. Now in stage 3 or the stage of the erosion, attitude will be flexion, adduction and internal rotation. And यहाँ पे क्या हो जाएगी, true shortening. तो कोई आपसे पूछे टीबी हिप में true shortening होती है, इनिशियल स्टेजेस या स्टेज 1 साइनोवाइटिस में abduction होता है, इसलिए there is apparent lengthening, stage 2 में apparent shortening, and in stage 3 or the final stages या full fledged TB of the hip में there will be true shortening because there is actual destruction of the bone that is occurring here, actual destruction of the bone or the joint is occurring here, that's why there is actual there is true shortening. Okay, investigations में अगर आप radiological signs देखो, so there will be haziness in the bones and this is the earliest sign, and you should always compare it with the normal hip, and there will be lytic, oh sorry, okay, so there यहाँ पे क्या होगा, there will be light, where it is, yes, there will be lytic lesions and obviously there will be reduction in the joint space. Okay, there will be lytic lesion and there will be reduction in the joint space. Okay, now the outline of the bones will be irregular because erosion start हो जाएगा, तो the cartilage का erosion start होता होगा, then the articular surfaces and the ends will become irregular, and इससे क्या start हो जाएगा, इससे start हो जाएगा pain, and then धीरे धीरे the head and the acetabulum will be involved, there will be wandering acetabulum. Okay, so we have seen acetabular changes में क्या होगा, there will be wandering acetabulum and there will be dislocation of the head and the head will lie in the ilium. So on the ilium you will have a pseudo acetabulum and it is called as the wandering acetabulum. And signs of healing में you will see sclerosis around the hip. अब डिफरेंशियल डायग्नोसिस जो होता है उसमें अदर कॉजेज ऑफ मोनो आर्थराइटिस ऑफ द हिप आर द सेप्टिक आर्थराइटिस और द ऑस्टियोआर्थराइटिस, एंड वी हैव डिस्कस्ड एंड डिफरेंशिएटेड इट ऑल कि कैसे डिफरेंशिएट करेंगे एंड कौन से ऑस्टियोआर्थराइटिस नॉर्मल प्रोसीजर होता है, ओल्ड एज में होगा. ओके, एंड ऑल्सो यू हैव टू डिफरेंशिएट इट विद द स्वास एप्सिस और द इंग्वाइनल लिम्फेटिनोपैथी विच कैन बी एक्सरे में पता लग जाएगा, बोन में कोई चेंज होंगे नहीं, प्लस द एमआरआई और द पैल्पेशन ऑफ द लिम्फ नोड्स जो दोनों के अंदर मिलेंगे, लेकिन इसमें कॉन्स्टिट्यूशनल साइंस लाइक फीवर एक्सेट्रा ज़्यादा होंगे. ओके, एंड ऑस्टियोआर्थराइटिस वी हैव डिस्कस्ड. ओके, now the common sites are most commonly and first site to be involved in case of hip joint, it is the acetabular roof. Okay, it is the acetabular roof. It is the acetabular roof. Then it will lead to the femur head involvement of the epiphysis, then metaphysis, and at the last or least commonly it will be the greater trochanter or the GT. So principle of treatment is the same, that we have to preserve the joint. उसके लिए सबसे पहले you have to treat the disease or the infection by giving the ATT. Okay, so in stages 1 and 2 सिर्फ और सिर्फ ATT and physiotherapy and immobilization and caring of the joint से ही काम चल जाता है. You don't need to go for the surgery. But in the later stages there is great limitation, destruction of the joint, then you have to go for the surgery. But surgeries are done only after giving the ATT and controlling the infection. और rest करना ज़रूरी है तब तक by traction or the plaster, or hip joint में you will give the traction and you will ask the patient not to do weight bearing. Okay, operative treatment mein we have discussed joint debridement, girdle stone arthroplasty, arthrodesis also you can do, corrective osteotomy, or the final stage or the treatment of choice is your total hip replacement. याद रखना, the treatment of choice is your total hip replacement. Okay, now we'll come to the tuberculosis of the knee. Tuberculosis of the knee में synovial ट्यूबरकुलोसिस होगा, एंड ये सुपरफिशियल जॉइंट होता है इसलिए इसका इन्फेक्शन बहुत कॉमन होता है. ये सुपरफिशियल जॉइंट है इस वजह से इसका इन्फेक्शन इज कॉमन. ओके, एंड बाकी सब कुछ जो होता है इट इज ऑलमोस्ट द सेम एज इन द टीबी ऑफ द हिप. ओके, बस इसमें जो सबलक्सेशन होता है दैट इज कॉल्ड एज द ट्रिपल सबलक्सेशन. दिस इज अ वेरी वेरी इंपॉर्टेंट. जैसे वहां पे वॉन्डरिंग एसिटाबुलम आपको याद रखना था, वैसे ही यहाँ पे आपको याद रखना है ट्रिपल सबलक्सेशन विच इज टीबी ऑफ द नी जॉइंट. इसमें क्या होता है, द टिबिया फ्लेक्सेस, there is flexion in the tibia when and it slips in the posterior direction and it rotates externally. See, like this. Okay, like this. There is backward tilt. Okay, see, backward tilt and external rotation. Backward tilt देखो condyles more prominent है and femur tibia पीछे tilt हो गई है with external rotation. Here you can see this is your external rotation, and if the joint is entirely destructed it is called as the triple dislocation. Triple dislocation में क्या होगा, triple dislocation में you will have flexion, पोस्टीरियर चली जाएगी टिबिया. टिबिया कैसा, टिबिया विल मूव पोस्टीरियरली एंड इन द एक्सटर्नल रोटेशन. ओके, सो हिप जॉइंट में इंटरनल रोटेशन होता है, नी जॉइंट में एक्सटर्नल रोटेशन होता है, और हिप जॉइंट में भी इनिशियल स्टेजेस में देयर इज इंटरनल देयर इज एक्सटर्नल रोटेशन. इट इज कॉल्ड एज द ट्रिपल सबलक्सेशन, एंड व्हाट यू आर सीइंग हियर इट इज द TKR, that is the total knee replacement in case of completely destructed joint of और द नी जॉइंट. ओके, स्वेलिंग होगी, मस्कुलर एट्रोफी होगी, कोल्ड एब्सिसेस, साइनसेस हो गए, वी हैव डिस्कस. ट्रिपल डिस्प्लेसमेंट और सबलक्सेशन होगा वेयर फ्लेक्शन, पोस्टीरियर सबलक्सेशन एंड एक्सटर्नल रोटेशन होगा. मूवमेंट विल बी लिमिटेड इन ऑल डायरेक्शंस. देयर विल बी एनकाइलोसिस, फाइब्रस एनकाइलोसिस इज मोर कॉमनर. रेडियोलॉजिकल एग्जामिनेशन में वही चीजें दिखेगी कि जॉइंट स्पेस इज वाइडेंड इनिशियली but at the last it is decreased. There will be synovium se start, okay, then cartilage, destruction of the articular surfaces of the bones, pain, then there will be subluxation, dislocation, सब कुछ बिल्कुल वैसा का वैसे ही होगा, lytic lesions etc. we have seen in the image also. So principles of treatment is also the same. यहाँ पे बस you have to take care of the knee. How? By applying a skin traction, below knee skin traction or GT cast, you can do it. ऑपरेटिव प्रोसीजर्स में साइनोवेक्टमी, वुंड डिब्राइडमेंट, आर्थ्रोडेसिस कर सकते हैं. अब जैसे वहां पे आपको एक अलग चीज जो याद रखनी थी, यहाँ पे व्हाट यू डू, वहां पे था हिप के अंदर गर्डल स्टोन आर्थ्रोप्लास्टी, वैसे ही यहाँ नी के अंदर एक टाइप का आर्थ्रोडेसिस करते हैं एंड इससे मूवमेंट नहीं आती है नी जॉइंट की, जस्ट लाइक द गर्डल स्टोन, बट पेनफुल नहीं होता है. इट इज कॉल्ड एज द चार्नलेस कंप्रेशन आर्थ्रोडेसिस. ओके, इसका सिर्फ नाम याद रखना है आपको. एंड इसको क्या बोला जाता है, इसको बोलते हैं चार्नलेस compression arthrodesis. Now we'll come to tuberculosis of the other joints. Okay, elbow, shoulder and the ankle joints. क्लिनिकल फीचर्स जो होते हैं वो सब सेम होते हैं, एक्सरे फीचर्स भी सब सेम होते हैं. ओके, बट शोल्डर जॉइंट ट्यूबरकुलोसिस की एक खास बात होती है कि इट में नॉट प्रोड्यूस पस. So but it will be, there will be limitation of the movement of the shoulder joint and stiffness, so it has to be differentially diagnosed with the frozen shoulder. Okay, so इन दोनों को differentially diagnose करने के लिए you do the x-ray, and in x-ray you will see the changes of the tuberculosis of the shoulder. and जो shoulder का tuberculosis होता है जिसमें पस नहीं बनता है, उसको क्या बोला जाता है, उसको you call as कैरीज सिक्का. उसको क्या बोला जाता है, क्योंकि वी हैव सीन सिक्का इन मेडिकल टर्म्स मींस ड्राइनेस. ओके, तो कैरीज सिक्का इज द टर्म यूज्ड फॉर ट्यूबरकुलोसिस ऑफ द शोल्डर, एंड ट्यूबरकुलोसिस ऑफ द phalanx के लिए यू यूज द टर्म डक्टाइलाइटिस वेंटोसा, एंड फॉर द स्पाइन यू यूज द टर्म पॉट स्पाइन. Now TB osteomyelitis yani tuberculosis in the long bones, not in the joints, in the long bones. So epiphysis मोस्ट कॉमन साइट होती है, इज द एपिफाइसिस, एंड इसकी वजह से जॉइंट इन्वॉल्वमेंट प्रिटी अर्ली होता है, बट स्लो ऑनसेट होता है एज कंपेयर टू द पायोजेनिक ऑस्टियोमाइलाइटिस, एंड इट रेयरली अफेक्ट्स द शाफ्ट ऑफ द बोन्स. लो ग्रेड होता है, इसलिए इट इज जनरली सब अक्यूट. ओके, बट एक इम्पॉर्टेंट और डिफरेंशिएटिंग फीचर होता है, एक तो ये हो गया एपिफाइसिस का, एंड सेकंड वेरी इंपॉर्टेंट डिफरेंशिएटिंग फीचर फ्रॉम द सेप्टिक इज, सेप्टिक वाला इन मोस्ट ऑफ द केसेस इट इज यूनिफोकल, बट TB वाला it is multifocal. Okay, TB tuberculosis is multifocal. Okay, and third difference is that there is minimal or absent new bone formation or the periosteal reaction. Okay, जो periosteal reaction होती है it is absent or very minimal in case of osteomyelitis due to tuberculosis. So the lytic changes or the bone lysis will be very more, or it will be out of proportion as compared to the periosteal reaction. Now short bones जो होते हैं feet and hand दोनों के involve हो सकते हैं, and the most common site as we have discussed is the calcaneum. Okay, treatment सब कुछ same ही होता है. Spina ventosa is the dactylitis ventosa, phalanges of the hand, and the phalanges swell up like the balloon like we have seen. Okay, and there will be a lytic lesion with destruction of the phalanx. Okay, now Pott's paraplegia, it's the TB spine with neurological involvement. Okay, and याद रखना TB spine में spine का हमेशा anterior मोस्टली ट्यूबरकुलोसिस जो होता है वो होता है डॉर्सल स्पाइन, दैट इज thoracolumbar spine, उसमें भी जो thoracic spine होता है, dorsal spine, उसमें because यहाँ पे the canal is narrowest, and एक बात जो मैं आपको पहले बता रहा था दैट वाज दैट कि टीबी स्पाइन में ध्यान रखना, हमेशा इंटीरियर साइड ऑफ द स्पाइन इज इफेक्टेड फर्स्ट. ओके, इंटीरियर साइड ऑफ द स्पाइन इज इफेक्टेड फर्स्ट. Okay, so this is your एक internal gibbous sequestra. Internal gibbous is characteristic feature. Okay, and it is like this. Okay, this is your internal gibbous here in the anterior. Okay, as I've told you, anterior. Here you can see a prominence. This is your internal gibbous. Okay, this is your gibbous. Okay, now so we have discussed this already, and I'll have a rapid revision of the POTS paraplegia in 1 or 2 days. Okay, I'll give you that. So आज की क्लास के लिए बस इतना ही. I'll give you a rapid revision of the POTS paraplegia where you can revise or study POTS paraplegia in just like 15 to 20 minutes. Okay, so I have a special class on 6th, that is on Wednesday at 8:30 p.m. on deformities of the spine, so please do attend that. And we had 100% strike rate for the orthopedics in the NEET PG. All questions were either from my special class, my YouTube sessions, etc. We have covered the all, so you can trust us for your NEET PG preparation. You can trust the Unacademy. Okay, so thanks for watching my lecture. If you like the lecture, please like, share and subscribe. You can subscribe using my code on the Unacademy platform for various subscriptions, and you can get extra 10% डिस्काउंट. ओके, सो जिसका रिजल्ट अच्छा नहीं आया है कोई बात नहीं, एक ब्लेसिंग इन डिस्गाइज हो सकती है आप लोगों के लिए. जस्ट 40 डेज मेहनत करो INICT के लिए. It is a crackable exam, easy exam. Just do last 5 years papers, and जिनका selection हो गया and they are happy, enjoy. Focus on your counseling. Don't miss out on any important dates. Choose your branch. ब्रांच चूज करने के लिए सिंपल सा लॉजिक यूज करना है. अगर आपका कोई ड्रीम ब्रांच है, आपने सोच रखा है मेरे को ये करना है, गो फॉर दैट, और कुछ सोचो ही मत. अगर आपको नहीं पता, देन यू डिसाइड ऑन 2 or 3 ब्रांचेस जो आपकी रैंक पे आपको अच्छी जगह से मिल सकती है. देन talk to the guys who are doing the same branches in their institute, and उन branches के आपके पास में हॉस्पिटल्स या फिर आपका कॉलेज है, उनके डिपार्टमेंट में जाके work in those branches. Then you will get to see everything and you can decide very easily. Okay, so thanks